Hi, good evening, good morning, good afternoon, everyone. This is Dr. Monica Khatwani. As you all know, today I'm going to have a podcast with Mr. or I could say Dr. Rohit Mathur, who has done a very good job and he has been a doctor for past many years. Now his specialization is in gastroenterologist and he is also an endoscopist. So we have a lot of questions, Dr. Mathur. So first, we would like to welcome you on our show, and we are really happy to have you here.
Thank you, Monica. Thank you for a lovely introduction for me. I'm Dr. Mathur, the Rohit Mathur, as a consultant gastro. I'm working for last 1 year in NHS United Kingdom. Thank you for giving me this opportunity, and I'm happy to answer all of your queries.
Thank you so much, Dr. Mathur. As because I do counseling and I have come across a lot of people who ask me certain questions related to your field. So I would like to ask those questions, and it would be great if you can answer that in a very simple way so that our audience can understand that what exactly it is and how exactly it is causing the problem and how we can work on it.
Yes, I'll try my best to give best answers. Yeah,
You're
thank you.
already best, sir. So you need not to try your best. I'm sure you're already best in your field. So my first question is basically about uh, people have been asking about the irritable bowel syndrome. What exactly it is, like how it is done, or what to say, how it is different from the other disorders. Could you give some light on that?
Right. So yes, I understand that because in my clinical practice, most of the patients are having this irritable bowel syndrome. And it's very difficult to diagnose it because it's kind of a diagnosis of exclusion. By the means irritable bowel syndrome, the word defines the disease itself, means irritation to the bowel due to any cause. We labeled as a functional disorder by the means that we once we do any investigations like blood investigations or any kind of scans or any other investigation, we don't find any disorder or any problem in it, and that's why it's very difficult to diagnose. People suffer for a long time, and finally we got to know that this is an irritable bowel syndrome after multiple investigations. Yeah, people do feel like it could be a dangerous one, but we have not a dangerous one. But yes, so it is a kind of an just an irritation. Yes.
Okay.
People can have um, abdominal pain,
Mhm.
like a tummy pain, discomfort, or patient can have constipation, or it can lead to diarrhea and many other problems.
Okay. So is it more related to the gut issue or a brain gut connection problem?
I'll say it's not related to the gut in
Hmm.
proper,
Okay.
but it's always related to gut-brain axis, which is a new concept in diagnosis of irritable bowel syndrome. So at present, we are not in a conclusion what exactly the etiology of this IBS, but this is one kind of an theory that is gut-brain axis, where people can correlate the other mental issues related causing problem in the gut. So
Okay.
yes.
So basically, if I say in short, it could be related to if I have some mental health issues going on, I can see some problems in my gut, sort of kind of.
Yes, definitely. Yes. So basically, the irritable bowel syndrome has multiple predisposing factors.
Mhm.
One is definitely the stress. Second is anxiety, other emotional disorders, food-related problems. Yeah. So all this can cause your gut kind of an unhealthy, and then can lead to irritable bowel syndromes. Yeah. Kind of a more sensitive gut, in other terms.
Okay. So that means in order to be have do not have this type of disorder, we need to keep ourselves happy, which is hard these days.
Exactly. Exactly. Yes. Yes.
Okay.
Exactly.
Uh, Apart from that, what do you think? What could be the possible cause apart from the mental health? Do you think there is any other possible cause for that?
Yes, as I said, the best two thing which I can correlate for this irritable bowel syndrome is one is food.
Okay.
So nowadays we are changing lifestyle. Like in Western countries, we are eating more processed food,
Hmm.
while in Indian we are obviously eating multi more spicy food, and now in India also we are changing our diet to more processed foods. So that can lead to irritable bowel syndrome. Certain food, particularly which has more FODMAPs, is a kind of an carbohydrates, can increase the sensitivity to the gut, leading to more um, problems. Another thing is obviously you said you are the better judge for that. The stress, emotion, anxiety, depression. Yeah, few females can have hormonal disturbances that can also precipitate the irritable bowel syndrome. Yes.
Okay. So is it something that it can happen during the menstrual days, if I say, because female usually have the problem
Yes.
with the guts that time?
Yes. Yes. Can have. Yes.
Okay. And how it is basically diagnosed and what test can help to rule out the other conditions?
So as I said, that it's a diagnosis of exclusion. So we need to rule out some other problematic conditions like inflammatory bowel disease, which present exactly same as IBS. Other like celiac disease, where the gut is affected. Other kind of an malabsorption, that is absorption related problem in the gut. So we have to rule out step by step by doing your blood test, by doing your stool test, and if required, more invasive procedures such as colonoscopies and sigmoidoscopies. So, yeah. So once everything is ruled out and you don't find any inflammation in the gut or anywhere, then it's likely to be an irritable bowel syndrome.
Okay. So basically, we need to go through all the tests first and then we will be able to know
Yes.
that yes. Okay.
Yes. Yeah, so I suggest all the patients to go for the test because it's not an easy job to find the irritable bowel syndrome and should be, yeah.
And what are basically the biggest triggers? As you said, stress can be a biggest trigger. Is there any
Yeah.
kind of specific food that you suggest that we should not take? As you suggested right now, processed food. So any
Yeah.
other kind of food that is like very that can cause this type of disorder or disease.
The food contains more FODMAP, so that's a kind of an carbohydrate. So
Mhm.
such carbohydrate once goes into the intestine, is not easily digestible, can produce more gaseous substances, can leading to bloating, abdomen distension, pain. Yeah, so that causes irritation. Some patients do have loose stools, and some patients have constipation. Some patients have altered bowel habits, like means alternating with the diarrhea and constipation. And
Okay.
some patients have only bloating. So yeah, so the food can be that one. So that's kind of a low FODMAP diet.
Hmm.
So that and the food, I'll suggest that try to check your food which causing more problem. And I suggest the patient to change the diet to the low FODMAP in comparison to high FODMAP diet. Yeah.
Can probiotics help in this symptoms? Can if somebody is taking the probiotics, do you think it
Yeah.
is helpful? Because nowadays there are so many ads telling the probiotics, they are selling the probiotics, selling that it helps the gut, it helps the gut. So, in what sense it can help the gut, or does it really help the gut?
Yeah. So as per the guideline, it is not suggested, but there are multiple trials going on. The probiotics and prebiotics actually they are made for a good bacteria. So they provide your good bacteria in the gut, and as I said, you the gut-brain axis, what we are in trial and under investigations and whatever. So that thing is also depend on the gut microbiome. So you have good bacterias, you have bad bacterias, and both are
Okay.
in proportionate. So if anybody is high or low, can change the local environment, can causes more sensitivity and IBS. So yes, um, there's a trials, but yeah, if the patient can try, that's fine. It's all depend on the patients. Yeah.
So you use the word right now prebiotic also, apart from probiotic. Could you help us understand what is the difference between prebiotic and probiotic? Is there any difference or they both are same?
So, the food which increases good bacteria in your gut,
Mhm.
in layman language, then it is considered as prebiotics. And the
Okay.
probiotics is actually the bacteria which we are giving in sachet or tablet form or capsules.
Okay. So basically, whatever is present inside is prebiotic, and whatever we are taking from outside that can be probiotic in tablets or
Yeah,
tea form.
so if you take some food which helps in growth of a good bacteria in your gut, then it is considered as prebiotics. For example, curd, what we are using in normal day-to-day life.
Okay. Mhm. And how does exercise impact this IBS? And are there any
Yeah,
specific activities that can help alleviate the symptoms?
yeah. So exercise helps in increasing the motility of the gut.
Okay.
Yeah. So once it is have a good motility, the symptoms reduces. You will eliminate all your bad bacteria, and the patient constipation will reduce. So that in that terms, it helps, and it in exercise also elevate your mood and decreases the stress and anxiety. So that in that way, you can also have a good impact for irritable bowel syndrome. Yeah.
Okay. So, and what are the biggest misconceptions that the people actually have about IBS?
Yeah, I think the what the people ask me in the clinic is it a lifelong condition?
Okay.
Um, or it could be a cancerous one, turning into the cancerous one. So as of now, we don't have any evidence the IBS, irritable bowel syndrome, having risk of cancer. So these patient doesn't have any risk of cancer, right? Second one, people think about the lifelong condition. That could be true because these conditions are coming in comes and like in a flare. So once patient having symptoms and then it treated and then it again come in some certain period of time.
Mm.
So yeah, so in that way it could be considered as lifelong one. Um, People think sometimes in other way, people think it's just a abdominal pain.
Mm.
So they think um, it should be irritable bowel syndrome, but I suggest you that every abdominal pain cannot be irritable bowel syndrome. It could be something else. So we should take it all the symptoms very seriously and should consider a referral to doctors.
Okay. And how does basically IBS impact mental health? As you said that it is caused maybe due to mental health
Yes.
issues, but does if somebody has that syndrome or somebody has that problem, do
Yeah.
you think the mental health of the person is also affected?
Yes, yes. Quite significant. Yes.
Okay.
So irritable bowel syndrome because it's an ongoing thing.
Mhm.
So if you think about that, if the patient have irritable bowel syndrome with diarrhea type, and if you are going for a ride or going for a market and you have to go for the opening your bowels and then it causes trouble. So yeah, so it affects significantly lifestyle as well as the daily activity, leading to more anxiety and more problems. Yes.
Mental health issues, right?
It's kind of a vicious cycle
Yeah.
leading to more symptoms.
So it is basically the vice versa. Mental health issues can cause
Yeah,
IBS, and IBS can cause mental health issues.
mental.
Okay.
Exactly.
All
Yes.
right.
Yes.
And are there any new treatments or researches baked through in this IBS management?
There are multiple researches going on.
Okay.
As I said, there are still research on gut-brain axis.
Mhm.
There are still research going on for the good bacteria versus bad bacteria, what to give, what not to give. There are still researches going on the food allergies. So we are doing that food allergies for most of my IBS patients. I'll check the food allergy. Yeah, so there are multiple things going on at the moment.
Okay. So, what suggestion or what advice would you give to somebody who has been newly diagnosed by IBS?
Yeah, so I ask them to keep calm and relax. Try
Okay.
to reduce your anxiety, try
All
to
right.
reduce your depression,
Yeah.
do moderate activity daily, drink plenty of fluids, find out which food is causing more trouble to you, try to avoid that food. If you have persistent symptom, try low FODMAP diet. And if its symptoms are persistent, particularly when the patient have some worrisome features such as loss of appetite, weight loss, or
Mhm.
any bleeding associated with that, persistent pain, no feeling sick, persistent vomiting. So that patient should go to the doctors and take advice from the doctors and have fully investigated, and then only they should consider. Yeah.
Okay. So you use a one word in between that is called FODMAP. What exactly is
Yes.
that?
So is a oligosaccharide, monosaccharide, polyols. So basically type of carbohydrate. So
Hmm.
they are not very easily digestible one. So
Okay.
that can be present in lentils, cabbage, cauliflower, and certain fruits like apple, bananas. They contain more high FODMAP diets. So they are so that's not easily digestible. So if it is not easily digestible, then it causes more trouble, causing more production of gases and many other things. So that causes more pain, bloating. So yeah, so there is a definite evidence with if you try low FODMAP diet instead of high FODMAP diet, then it causes symptoms relief. So that's the first line management of any irritable bowel syndrome.
Okay. And when we say that okay, low FODMAP food or low FODMAP diet, so what sort of food that we should notice that okay, like you gave some example, cabbage, cauliflower, and our lentils. Are there any other foods that we should be noticing that if we are eating this food, this is happening or bloating is happening or something like that?
Yeah, I mean, there are a lot of food available. So a
Mhm.
lot of food which can have a high FODMAP,
Mhm.
and it is something which patient can actually decide which is causing more trouble.
Okay.
It's very difficult to identify that the food which is having high FODMAP causing a direct problem, or it is a food intolerance which causing the problem. So exactly speaking, the patient is the best judge to find out which food is causing. I suggest my patient to keep a food diary and find out which causing problem in the scale of 1 to 10 and try to eliminate step by step and follow the procedure for another food. So that helps them. Yeah. It's easily the list is easily available on the Google and anybody can search that. That's not a big problem.
And is that
Yeah.
work that problem, or if I say this kind of syndrome, can be worked upon? The people can really get well after taking or examining or doing the treatment. They they might not be having the problem again, or it is chance that they can have the problem in the future also.
Yeah, I mean, if the people follow the proper advice,
Hmm.
the chances of getting another episode is less. So the
Okay.
people can have longer duration of symptom-free interval,
Hmm.
but it's not always guaranteed. It can patient can have another episode,
Hmm.
but the treatment is simple. Like you just relieve your anxiety, do exercises, yoga, or any sort of behavior therapy. You must be knowing about CBT
Yeah.
and food and many other things. So yeah, the treatment is always the same. If the patient having severe pain, they can take some painkillers after doctor's advice. Yeah, but they can relapse. Yes.
Okay. All right. So it was wonderful information, Dr. Rohit Mathur. I think my audience would definitely understand the role of mental health issues in having the gut
Exactly.
problem and how they
Yes.
should actually take care of themselves before their body take care of them, and which can be in the negative way. So thank you very
Yes.
much for being with us, and thank you for giving a lot of information. I'm sure my audience is going to know more about it, learn more about it, and I would suggest if you can give your email address or something, the people can connect you if they would like to connect you for their problems, and they can actually take suggestions from you if you want.
Surely, I will provide you so that you can add that. Yes.
All right. Perfect. Thank you so much for your time, and thank you for
Thank you.
your
Thank you
wonderful
for,
time.
thank you so much.